Okay, I'm really very happy to be back here after so many years. I like memory lanes, I'm very sentimental. And these are some of the memories. I'm going to spend some of my precious time. This is Gianpaolo with Cynthia, still dating years ago. That was his birthday. And this, we had a fantastic time in Sopron with our really, really missed friend, Forlini, with the Three Musketeers. And this when Gianpaolo was in Egypt many years ago. So that's about the memory lane. Let's go back to business. So I'm going to talk to you about a nuisance when you operate on such an easy case. This is a bullous retinal detachment. You do your work, you close the brake and leave the eye with gas. And the following day, you find, not the following day, after the gas is gone, you find this horrible situation of a really nasty macular hole with, macular fold with very poor vision. I'm going to go through with you on some of my cases. I used to wonder, how can this problem or complication happen? Until, speaking of the devil, it happened to me. And this was the first case. As you can see, the macula looks fine, and it was actually a bullous retinal detachment. It all went fine, but a few days later, after the gas is gone, a macular hole and very poor vision, very poor vision. Well, I elected to wait and see what's happening, and actually the man died. Not from the macular hole or macular fold, but he was leukemic. Fortunately or unfortunately, I don't know. This is the second case here. Again, this was straightforward, and after the gas is gone, you can see the very nasty macular fold, visual acuity 0.2, and I elected to operate, and this is, you do the ILM peel. If you haven't done the ILM peel first, and then I'll show you what we do. I elected to re-detach the retina using the 41 gauge BSS injection. Leave the eye with gas and see what happens. During that, you can really massage the retina with a soft tip cannula. And this is the situation, an excellent anatomical result, but actually the visual acuity doesn't improve that much. And it's a pity because this has persisted for actually now 1 year. This is the other case here, case number 3. This was a police officer, operated a nasty macular fold. As you can see here, was very unhappy. I elected to wait and see, and what happened is a macular hole, to make things worse in this patient, a macular hole, so I had to re-operate again. And in this particular case, I elected to massage the retina from behind. I injected, in addition to the BSS, some air bubbles, and this actually was very good. This is 1 year after. The macular contour is okay, but the vision is poor, and he does have some macular edema. So post-operative, the macular folds, risk factors, you probably know, upper bullous, gas tamponade, incomplete drainage, and this is the pathophysiology. This is how things happen. Yeah. This is from a very nice paper, and the management conserve only when the macular fold is very mild and the vision is good. But in severe cases, surgery is mandatory. You can do ILM peel with detaching the macula, ILM peel, massaging the macula from the inside or from the outside. So a take-home message, macular folds have a devastating effect on vision, and prompt surgical intervention is recommended. Please don't wait for these patients. Visual outcomes are not satisfactory even if the anatomy is better. Prevention is the way to go, and I urge you all to reconsider and make sure that this complication doesn't happen to you. Please read this very nice review article by Sylvia Bopp and Hyman, and thank you very much.
Thank you. Gianpaolo, at what time do we have to stop this session? How many minutes? Let me know. I think that, thank you for your presentation, great, because this is one of the things you want to avoid instead of treating, of course. One comment is that it's very easy to induce a macular hole when you inject and detach the retina, as always, even in any case when you try to detach the retina. So I think it's better to inject the fluid far from the fovea instead of starting close to the fovea, because it happens to me.
Yeah,
You turn a macular fold in a macular hole.
But believe me, these macular folds are so difficult, very, very difficult to unfold.
Yes, thank you.